I'm from the Baycrest Centre for Learning, Research and Innovation, so sister center to the Schlegel Centre. And one of our foci is really around how can we enhance teamwork or interprofessional competencies in long-term care through educational innovation. So I think today's presentation or this workshop and the activity that we're doing really ties into some of the themes that we've heard from staff and speakers this morning in terms of being relational centered, having shared values, and so on. And so I think you'll see how this applies quite quickly. So essentially, a little brief overview of why we focus on interprofessional learning, and then we're going to go right into an activity. This is an activity you can easily take back to your homes and do with your teams. And then I will introduce one of our interprofessional learning initiatives and talk a little bit about the bigger context for education within an organization. So one of the things that we noticed when we started working with homes and doing our learning needs assessments is that when it comes to sustainable practice change, implementing innovative ways of doing things, you really need functional teams, right? When teams don't work well together, it's really hard to change things because they're not communicating or they're not coordinating. It kind of falls apart. And one of the other things that we noticed was that often homes would have opportunities to send staff to education, great education out there in the sector. And what would happen is they would kind of randomly pull people based on who was available, what shifts needed to be covered, and it was kind of distributed across the organization to be fair and sort of kind of that equality principle. But one of the challenges we thought we wanted to address was this idea of team learning and sort of building some mass capacity within a team so that they had a shared language and they had a common approach so that when they came back, you had a higher potential rate of success in terms of actually changing the team's behavior, especially when you go across shifts, as we just talked about. Okay. So my question to you is, what does your dream team look like in long-term care? So what knowledge, skills, and values would you like to see in your teams if you were trying to enable change? This is your question.
I think my dream team would look that they all have different skills, knowledge, and attitude, so that as a whole, it was like 100%, or however you want to look at it, so that we really complemented each other. So if I had someone that was really good at palliative care, but didn't want to have those tricky conversations with people, then have someone that's good at initiating those conversations with people. And so
Great.
So I could build capacity that way.
Okay, so if you had a really diverse team with diverse skill sets, what would you need that team to be able to do to work together?
Just manage through conflict resolution, and come out with actual results at the end.
Okay. You want them to be solution focused. Okay.
Communicate.
Yes. Right? Like if we all have different pieces of the puzzle, we need to communicate, right? To share those in an effective way. Anything else? Respectful.
Building relationships.
Building relationships.
Common goal.
Common goal, yes. Common goal, very good. So we've asked this question a few times to a number of groups. And these are some of the ideas that come up, right? So beyond kind of the basics of communicating and being collaborative, what about the idea of being proactive in your work? What about the idea of being self-reflective? Solution focus was mentioned. Being flexible, being creative. All these values, attitudes, and skills are actually interprofessional competencies. Okay? So it tied in nicely. So interprofessional education really happens when two or more professions or disciplines or work roles work with, from, and about each other, right? They're learning together to improve collaboration and quality of care. And so as we were starting to design our learning, we wanted to have a framework to guide us, because once you start thinking about teams and what you'd like from them, there's a whole wide, vast world of things you could be doing. So we landed on the University of Toronto framework for interprofessional competencies. And this is really about collaboration, communication, values, and ethics. And I'm happy to share that resource. It's actually broken down, and within each of those, it has the various characteristics, like being proactive, being collaborative, solution-focused, interdependent, and so on, diversity-sensitive, relational-centered. It's all broken down. And so we use that when we were designing learning activities for teams. Okay, enough said. What I'd really like to do is to do a team puzzle activity. So Kate, we can start sharing the puzzles. Don't open the bags yet, okay? So there's going to be kind of puzzles, almost one for every row. We have 12 puzzles. You can divide into groups of 6 or 8, so probably you're going to group in your rows. Assign 2 people from your group to be observers, and they'll help report back to the group on what was happening for your group. When the timer starts, you'll have 3 minutes to finish the puzzle. All right, and the idea behind this puzzle activity is really to help us think about how we work together as a group, as a team. So one of the things I'd like to sort of do is take a step back, because I've been sort of debriefing this as a small example, right? Take a step back and take off kind of the facilitator hat and talk about the activity itself from an educational perspective. Some people thought they finished the puzzle, and only one team really did. So what happened when you got to the end and you saw a missing puzzle? What'd your team? A missing piece. So one of the neat things to think about when you're facilitating this activity is the missing puzzle piece, right? I said to one team, I said, if this was about a resident and you needed all the information, would you stop? No. Is your puzzle complete? No. You'd go find it. And sometimes you can elicit discussion around speaking up because you might be the missing piece. So you know on teams how some people hold back and they don't say it even though they could because they're afraid. So it's sort of one of the lessons you can elicit from this is around speaking up and sharing your voice. For team members. So that's another one that I really like. What you'll see on the activity sheet is some facilitator notes. So I actually had the puzzle pieces on me, those missing ones. There's some in my bag. The puzzle boxes with the pictures of the full puzzle are in my bag. So if you'd come and ask me nicely, I would have given them to you. So congrats to this team that asked me for the puzzle piece. All right, because we want to foster resourcefulness. We want people to be proactive and solution-focused and get it all done, right? The other neat thing about this is a very entry-level simulation. So if you're into simulation techniques and approaches for education, this is a very entry-level simulation. For moderate simulations, for every 1 minute of activity, you would have 10 minutes of debrief, right? Because you would want each group to have a chance to talk it through and so on. So this, you know, I've obviously shortened it, but it is a much simpler kind of simulation. It's not a whole full clinical situation with an actor or whatever. So, and the learning happens during the debrief, right? It doesn't happen during the activity, so never lose the debrief. That's where people start to reflect. One of the questions I would also ask you is, how does this activity, the things you learned today, how would that apply in your work? Because you bring it back to practice. So simulation and experiential learning can really immerse you in an activity, and sometimes that's a really good thing for learners. But we know that just sending people or just providing education for people doesn't necessarily lead to practice change in and of itself. We have to sort of be cognizant of the larger organization that we work in. And the Heath brothers in their book Switch, How to Change Things When Change is Hard, give us the analogy of the rider, the elephant, and the path. So I'll ask you, what's the biggest component of this picture? Which of the 3 components is the largest proportion? The environment, right? So they liken that to leadership and structures and processes. In order for change to happen, you need to have a clear vision. You need to have a path. And you need the supports to get you along the path. So that's leadership, right? So sending people for education and bringing them back without having a vision, supports, and resources that are going to enable them to apply that education is not necessarily going to lead to change. So that's one element. So the little guy on top represents the rational mind. And this is where a lot of education, we tend to focus. You know, what knowledge and skills do you need to know to do X, Y, and Z? So the challenge becomes, if I know what to do, I know how to do it, and I know why to do it, which most people do, why doesn't change happen? And so they suggest that we need to attend to the elephant, which is the emotional mind. And it's much larger proportionately than our rider, right? It's the elephant in the room. And so education and leadership that support those shifts in values, attitudes, and beliefs are going to help create change. So bearing all of that in mind, we developed a Team Essentials program for long-term care that introduces leading practices on key priority issues related to reducing emergency transfers, coordinating care for responsive behaviors, engaging families in care, and building teams. So these are very evidence-based. We've shifted to an education implementation model, recognizing that we do need leadership on board, right? And we do need to go back to the homes after the education and provide follow-up visits. So how's it going? What's working? What's not working? And providing refreshers to staff. I think it's sometimes a mistake to think that education is a magic bullet and that it's going to change things. We need to sort of work all together to do that. This also was designed with our workforce in mind, so very much geared to experiential learning. And in addition to knowledge and skills, it addresses the values and attitudes of learners, so the human side of learning. It's also about learning how to learn and learning about others. So that's all kind of built into the program. Of course, we're integrating our interprofessional competencies. And the other unique piece about this is we say, don't send random individuals to us, send us the triads and the quads that work together. So for acute changes, for preventing acute changes, we ask for the nurse with 3 to 4 PSWs that normally work together on the same shift to come together. Because when they come together, they're getting a common approach, a common language, and they have the opportunity to have all those aha moments, such as the puzzle activity, together. And those kind of moments, or experiential learning moments, help shift attitudes and values, those things that are harder to shift in didactic terms. So I guess, in summary, my advice to you is it really helps to embed an interprofessional competency framework into your learning. You can always think about what you're teaching in terms of being relational centered, fostering reflective practice, and changing attitudes and values. So I strongly recommend that in terms of embedding the competencies into your learning activities. The learning framework actually allowed us to be very focused in our learning objectives, because when you get to a complex issue, which most of the issues are in long-term care, in terms of care and teamwork, there's lots of directions to go in, and having a framework actually allowed us to narrow and focus, and it made things cohesive across the curriculum, whether it was within a module or across modules. So that was really helpful. And I would say also see how you can use education to attend not only to knowledge and skills, but also to kind of the attitudinal and relational aspects of teamwork.
Just wondering, do you need special training, or how do you get trained to kind of teach your teams this in the homes? Or do we go to Baycrest to get that training?
So it depends. There's some entry-level simulations. If you're an educator and you have some basic education principles, it's not a big shift to start taking on some of the basic simulation pieces. Sim1 is Ontario's simulation network, and we partner with them. They offer a wide variety of training for educators in simulation if you would like to sort of go down that route and build a skill set. One of the things that we are looking to do is to build a long-term care learning network through activities such as this, where educators have a chance to come, to learn, to get some of the basics, and to have activities that they can take back. So if you'd like to be part of that, we will gladly put you on our distribution list as we gear up and start to be sharing things more broadly. Does that answer your question? Yeah, so we'd welcome collaborations. And we've definitely attended events such as this, or the PRCs are hosting something somewhere and they'd like to learn a little bit, some simulations for responsive behaviors or frail aging. We've done that too. the idea is to get it out, right, so everybody can use it.
Hi. Have you done an evaluation of this new model yet? How new is it? Just wondering on the outcomes you're seeing on the units.
On Team Essentials? Yeah. So very interesting because it's taken us 3 years to go from concept to design to testing to finding partner homes and all of that along the way. We've done developmental evaluation, which is something you use for innovation because things are always changing. And that means gathering information along the way to inform new changes, right? So that you're always refining. So in terms of staff satisfaction with the actual education, it's quite high, like 97%. So we kind of have those process measures in place. In terms of kind of like outcomes in the homes, we have collected stories and anecdotal vignettes. So we have homes that are reporting that their emergency transfers have gone down, and so they're now integrating some of our training into their orientation, which is lovely. So that kind of thing is coming back to us. Yeah. Oh, one more question. I would say as we're moving forward, we're looking for partners who would be willing to test this with us now that we have a fuller package ready to go, to sort of be the test sites where we can really kind of implement it and evaluate it. So if you're interested, let me know.
So that was what I was going to ask. Are they modules, the Team Essentials? Because I know in Ottawa you were presenting some of them, the gamification and things like that. Are they ready to go now, those modules, and available? Or no, do we need to go for training first?
So right now the modules for Team Essentials incorporate things like gamification and simulation, which we do as separate workshops. But the modules themselves for teams and homes are ready. We've been delivering them. We do them in person at Baycrest right now. This year, for our plan, we are taking the acute changes module and turning it into an e-learning module, and we're looking for a partner home to help us test that. We also have a gamified app that's post-learning for that acute changes module. So we're starting to shift towards e-learning. The other thing is, should the CLRIs be refunded for another 4 to 5 years, we will do train the trainer sessions so that it can have further reach.